28 सालदेखि मेरो छोरी त्यो जेठी छोरी गर्भमा आयोदेखिको भएको त्यहाँदेखि पहिला थिएन। बच्चाहरू सानो सानो थियो, श्रीमान बित्नुभयो। मैले आफैले पढाएर हुर्काएर बढाएर दुःख गरेर बसेको। उही बेलाको सम्झ्यो भने रुनु मन लाग्छ मलाई, आँसु आउँछ। धेरै दुःख कष्ट गरेर बस्यो कि।
Nilikonjeka kwa ugonjwa wa karasa, nikajaribu kutumia dawa za kienyeji, hakuna, hata zingine karibu kuniua. Nikaenda hospitali, nikapewa dawa ya malaria, nikatibiwa, hakuna.
Kuna watoto 9. Kati ya hii watoto 9, 4 ndio wamepata kalasa. Sasa kati ya hii watoto 4, mmoja ameenda, ameaga.
Hauzi yo wumpa papa na share force there, ya ba force there, ya ba family bia benya ni jina bi papa we jina. Ma omba ya danya. Chami mankobi. Muso mara penda mbomo mazama woso wa ku school. Na we tum woso wa za bo wa ba sa na mata so samwo wo. Woso we tum wa za mo webra. Mo fa muso ma kaona ani mu.
We're going to see all Ghanaian school-age children healthier and paying more attention in class.
I hope to become a doctor, a medical doctor.
I want to be a teacher because I know all the subjects, math, English, science, and social.
By controlling worms, we are investing in our future.
Neglected tropical diseases are preventable and treatable, yet they continue to cause suffering across the world. You can make a difference by investing in these diseases, helping change the lives of 1.7 billion people affected by NTDs. There is much to do, and we need your support, backed by bold financial and political commitment. Take action, become launch champions, and march to the beat of a united drum. A global heartbeat, a powerful rhythm, beating a drum for change. Be courageous, be caring, be compassionate, be 100% committed.
Well, a very good afternoon, Your Excellencies and distinguished guests. It's showtime! A warm welcome to our 100% committed launch event coming to you live from Johannesburg, South Africa. My name is Tammy Nkadimeng, and it's my great pleasure to be your co-host today alongside my friend and colleague, Ariel Dinanga.
Thank you very much, Tammy. Good afternoon, un très bon après-midi à vous tous qui nous joignent cet après-midi autour du monde. Quelle façon de commencer nos travaux plutôt que d'évoquer belle et émouvante histoire partagée par toute personne concernée qui culmine avec cette apparition explosive du drame café sud-africain, démontrant l'incroyable impact que beaucoup de gens peuvent avoir en créant quelque chose de vraiment puissant.
Absolutely. Well said, Ariel. A powerful opening indeed. A literal drumbeat to Kigali as we look to commence with our official program today and to formally welcome you to our launch event. It is my utmost pleasure to introduce the Chief Medical Officer for England, who is also the UK government's Chief Medical Advisor, in addition to his role as Head of the Public Health Profession. He represents the UK on the Executive Board of the World Health Organization and is a trustee of Sight Savers. Your Excellencies and distinguished guests, Professor Sir Chris Whitty.
Thank you, Tammy, for that warm introduction. The reason that we are all together talking about neglected tropical diseases is because these are some of the most appalling diseases known to humanity, old diseases, which affect some of the most marginalized groups around the world. And at the same time, in the great majority of cases, these are diseases which, with action, can be prevented or can be treated. And it's very important, I think, that we do not lose sight of the fact that these diseases can have absolutely massive impacts. I'm going to just give a few examples out of the many diseases that are grouped together in the NTD domain. For example, two fatal and very unpleasant diseases, neurological diseases, human African trypanosomiasis, several areas of Africa, without treatment, 100% mortality, and a chronic and very unpleasant disease until that point, or rabies around the world, a disease which can be entirely prevented by vaccination, which again has 100% mortality, and all physicians, including me who've seen it, would say one of the worst ways to die that is available. Then we have many diseases among the NTDs which cause years of disability and major impacts on individuals and their families, such as the blinding diseases trachoma or onchocerciasis, two diseases which I've seen both again clinically, but also as a trustee of Sight Savers, which has done much of the work to try and address these. So these are diseases, and I will not go through the full list, but these are diseases which have an appalling toll on families and on society as a whole. What happened in 2012, 10 years ago, in the London Declaration, is that some of the key groups came together and said, look, these diseases are a major issue that has been invested in and overlooked for too long. And these included, and most importantly, of course, those who are affected. And I really like to pay tribute to those who did the very moving videos we've just seen. But all around the world, affected communities and their representatives and the governments of the countries where the affected communities live. Also donors, including governments and major donor organizations and philanthropic organizations, such as the Melinda Gates Foundation and the Carter Foundation. Academics, because only with new science and new research can we develop the tools of prevention and the treatment that is available, and delivery organizations, including many NGOs from affected countries and internationally, and volunteers. And importantly in this area, the industry, including the pharmaceutical industry, which has donated drugs to many of the mass drug administrations. And it was important that this coalition came together because no individual group could alone tackle these major problems in some of the most marginalized communities. This has taken extraordinary political leadership also from leaders in affected countries, and the Kigali Declaration, which is really the culmination of this, I think is a demonstration of the very clear political commitment from affected countries to tackle these diseases, which we all wish to see taken down to a much lower level than they are. Now, we've had substantial successes over the last 10 years. If we think about, for example, human African trypanosomiasis, the rates have dropped to an all-time low now of 700 reported cases. Of course, the true number will be higher than that. But compared to where we were 10 years ago, certainly compared to where we were 20 or 30 years ago, a very substantial improvement. We have had very clear improvements through mass drug administration in many of the blinding diseases. And we have tools to tackle the great majority of the neglected tropical diseases that we face. That doesn't mean we don't need better tools, we don't need safer tools, we don't need tools that can more widely be used. But many of the tools available to us are simple. For example, the filtering of water, which has helped to get us close to the eradication of Guinea worm. We have the tools, we've seen significant success, but our advantages and our advances are fragile. And we've seen in the last 2 years during COVID that many of the programs that have been so successful have had to either move their activities onto addressing this really immediate threat of COVID, or have had disruption due to necessary actions that governments in affected countries have had to take. So I think the idea that, in the sense there are two dangers, the danger that people think these diseases cannot be tackled, absolutely they can be. We have tools, we have political will, and these are things which we should be aiming to get as close to zero as we can. The alternative view that actually these are just going to go away, that is not true. We need complete and 100% commitment to improve our actions, and that way we will actually reduce the burden of these diseases in so many of the most marginalized communities in many parts, many countries around the world. So the London Declaration, which brought together this coalition, the Kigali Declaration, which is going to extend the political leadership from leaders in Africa and Asia and other Latin America and other affected countries are critical, but it does go back to the fact that we need commitment from everyone. And this is a whole of society response to these major diseases which have had such a burden around the world.
Well, I couldn't agree with you more, Sir Chris. Thank you for that. These diseases indeed will not go away on their own. And with action, they can be prevented or treated. And for this, as Sir Chris mentioned, we need commitment from the whole of society. You can play a part and you can make a difference. If you look at the bottom of your screens, you'll notice there's an official handle for today's event. We invite you to continue the narrative and the conversation, to raise your voice and call to action everyone across your social media platforms using the hashtag 100% committed. And we also encourage you to let everybody know that they can also follow us on www.100percentcommitted.org.
On that note, guys, as we mentioned, social media is very important. You'll also notice on our chat functionality, we encourage you to join us and use the chat and posting question and thought and commentary during the course of our event. And later on, we're also going to share some of those thoughts with you and comments.
But right now, though, we have the pleasure of inviting Honorable Abe Shinzo of Japan to offer a few remarks.
皆様こんにちは。衆議院議員の安倍晋三です。本日は世界顧みられない熱帯病の日ということで、私から一言ご挨拶を申し上げたいと思います。この顧みられない熱帯病は英語では Neglected Tropical Disease 略称 NTD と呼ばれており、世界での感染者数は 10億人を超えると言われております。貧困との関わりが深い感染症であり、世界の健康格差をまさに象徴している病気であります。国連の持続可能な開発目標、いわゆる SDGs でもその目標3、すべての人に健康と福祉をの中で NTT 対策については明記されており、世界100カ国以上に広がるこの感染症群に対する医療的介入が必要な人々の数を2030年までに 90% 削減することが目標として掲げられています。熱帯病と聞くと熱帯地域の病気というイメージを持ちますが、実はこの顧みられない熱帯病のいくつかは日本でも公衆衛生上の問題になっているそうです。その詳細は本日のセミナーに委ねますが、まさに世界と日本の健康問題はつながっていることを実感させてくれます。これは昨今の新型コロナウイルスの流行でも再確認した通りであります。感染症に打ち勝つこと、そして人類の健康を守ることはグローバルな課題であります。日本に住む我々も世界の人々と手を取り合って感染症に向き合っていかなければなりません。その中でも特に NTT に代表されるような地球規模での健康の不平等をなくしていくこと、これは日本を含めた先進各国が積極的に取り組むべき課題と考えます。日本はこれまでグローバルヘルス分野で確固たるリーダーシップを世界に示してきました。これは世界の健康を守ることが日本の人々の健康や安全を守ることに直結しているという信念に基づいています。特に感染症分野では1998年の G8 バーミンガムサミットで当時の橋本龍太郎首相が寄生虫症の対策を国際的に進めることを提言されて以来、国際協力と研究開発といった面での投資を進めています。NTT 分野におきましても、これらの取り組みが功を奏し、新しい治療薬の開発や途上国における感染拡大の抑止という具体的な成果として現れていると聞いております。本年には TICAD がチュニジアで、来年2023年には G7 サミットが日本で開催される予定です。日本がこのような機会を活用し、世界の感染症対策においてさらなるリーダーシップを示すことができるよう期待しています。本日のセミナーを機に NTT の収束に向けた機運が高まることを大いに期待を申し上げてご挨拶にいたします。ありがとうございました。
Thank you so much, Honorable Abe Shinzo. It was fascinating to hear the importance of interconnectedness. What a word that includes integration and collaboration, the rallying call to action across borders, and that COVID-19 has shown us the need to join hands and forces around the world to end NTDs.
Our next segment kicks off with a remarkable animation celebrating the 10-year anniversary of London Declaration. Take a look.
The fight can be unseen, and those affected many. Causing hell on earth, their impact is deadly. From pathogens to viruses, helminths, and bacteria, these microscopic miscreants arrest people's livelihoods and dreams. These are the indelible scars caused by NTDs. Communities overwhelmed and affected. 1 in 5 people living with diseases that with funding and research could be ended. 10 years ago, partners, pharmaceutical companies, donors, and NGOs came together to fight NTDs through the London Declaration. Paving the way, coming together, working with communities, delivering treatments, advocating with people for a future that's better. Making great strides and reaching greater heights. We've seen how partners have contributed to the solution. Billions of dollars contributed by generous donors. 13 billion treatments freely donated, making this the most unprecedented partnership in history. Health workers covering distances and districts to administer treatment, and it's working. 600 million are no longer in sickness, 43 countries with medical victories. Individuals no longer at risk of losing their sight, the restless can begin to rest their minds, and this was all down to you, our partners, working hand in glove with countries. We just want to say thank you.
And reiterating the call of action to Director Neglecting Tropical Diseases for the Bill and Melinda Gates Foundation, Your Excellency, distinguished guest, Dr. Katie Owen.
Good morning, good afternoon, and good evening. My name is Katie Owen, and I lead the Neglected Tropical Diseases team at the Bill and Melinda Gates Foundation. I am so pleased to be here today with many of the same partners that were with us in 2012 when we signed the original London Declaration and committed to an end to NTDs. Thank you to everyone who has made the past decade of progress possible. First and foremost, to endemic countries for your leadership, to NGOs for your collaboration, to my fellow donors for your long-standing support, and to our pharmaceutical industry partners for your invaluable donations of vital medicines and treatments, for your partnership in delivering those medicines, and for your commitment to R&D for new treatments and diagnostics. The Bill and Melinda Gates Foundation is incredibly proud to have been a part of this partnership since the beginning, and we remain fiercely committed to driving progress forward. As we have seen over the past decade, and as that previous animation showcased, unprecedented collaboration results in tremendous success. Since 2012, over 600 million people no longer require treatment for one NTD, and 35 countries have eliminated at least one NTD, including most recently Niger, which celebrated an end to river blindness just last month. The overall progress is truly astounding. However, as with so many of these things, we are not yet finished. Over the next decade, it is our hope that more countries can build on this legacy and continue to eliminate NTDs. For this to happen, we must strengthen our support in innovative collaborations, in political commitments, in funds, and in medicines donated, so that countries can take the lead and create healthier lives for their communities. The new Kigali Declaration embodies this tenet and will empower country ownership of elimination targets and treatment deliveries, not only helping to beat NTDs, but creating resilient health systems too, and ultimately creating a world where everyone has the chance to live a healthy and productive life. The Gates Foundation welcomes the new Kigali Declaration, and we are proud to say that we will be right there working alongside you toward a better future. We are, and always will be, 100% committed to ending NTDs. Join us.
Yes, indeed, Katie. Join us. At this time, it also gives me great pleasure to welcome Global Education Editor for the Financial Times, Mr. Andrew Jack, who is standing by to moderate and introduce an exceptional panel of individuals who will share with us the achievements of the past decade and what will need to be done differently. Hello, Andrew.
Thank you, Tammy. So welcome now to our panel discussion. My name is Andrew Jack from the Financial Times, and 10 years ago, I was following the London Declaration when it was first held. And we're going to discuss over the next 35-40 minutes or so with three key participants, really about the origins of the London Declaration, what was pledged at the time, what progress there has been since, and what the challenges are ahead in efforts to tackle and ultimately eliminate this group of neglected tropical diseases that still cause so much hardship and challenge for health and development in many parts of the world. We'll have here for discussion Haruo Naito, the Chief Executive of ISAI, Maha Barakat, the Director General of the Frontline Heroes Office, and Sylvia Gold, President of the Mundo Sano Foundation. But first, we're going to hear a short declaration from Ren Mingui, Assistant Director General at the World Health Organization.
The first NTD roadmap, 2012 to 2020, was launched in January 2012. The member states committed to the roadmap through the World Health Assembly resolution, while the partners did so through the London Declarations on NTDs. Under the first roadmap, the global intervention for NTDs reached more than 1 billion people per year for the first time. By the end of 2020, 600 million fewer people required interventions against NTDs compared to the 2010. The progress made was also substantial in low endemic countries, with 42 countries having eliminated at least one NTD by the end of the decade. The main features of first roadmap included the definition of clear milestones and targets for each disease, the identification of 5 core strategic interventions to tackle NTDs, the push for operational integration among NTD programs, and establishment of public-private partnerships such as major drug donation programs. Although not all the targets set by the first roadmap were achieved, the progress was substantial. The challenges identified and lessons learned were foundation for the new roadmap 2021 to 2030. The new 10 years roadmap was launched on 28 January 2021. After almost 2 years consultations followed by the endorsement of the World Assembly, it's built on 3 pillars: accelerate programmatic actions to scale up intervention, intensify cross-cutting approaches, integration, and mainstreaming to make health services more effective, resilient, and far-reaching. Change operational models and culture to encourage country ownership and sustainability. The roadmap's horizon is 2030. It is geared at contribution to the Sustainable Development Agenda, especially a target 3.3, ending the epidemic of communicable diseases, including NTD, and to the universal health coverage. One of the biggest challenges that the new roadmap has faced at the onset is COVID-19. NTD interventions has been the second most disrupted by the pandemic in terms of frequency and the most disrupted in terms of severity across all health services. This has multiplied the suffering caused by NTDs and has resulted in a delay in achieving disease-specific target and universal health coverage. WHO and partners has taken several measures to mitigate the impact of COVID-19 on NTD programs, but it is not enough and more needs to be done. Essential health services should be maintained and guarantees for all during the pandemic. WHO is committed to supporting the countries to get back on the track and further scaling up interventions to ensure the continuing progress towards SDGs. Our aim is to ensure that NTDs are no longer neglected and fully integrated into health services. Thank you.
Thank you, Ren Mingui. And now let's cast our minds back, first of all, to a decade ago, to January in 2012, when the London Declaration took place, which really put NTDs on the map globally and brought together funders with pharmaceutical companies, with foundations and countries to focus on attempts to tackle neglected tropical diseases, particularly through mass drug administration. Haruo Naito from ISAI, hello. You were there at the declaration. Tell us a little bit about your company ISAI's involvement in the past, previous to that declaration, and why you became so committed to the cause.
Yeah, thank you, Andrew. It was a typical London winter day. Some very cold rainy day, and we all get together with something like 100 audience in front of that. We sit together, all representatives. I believe Margaret Chan, Bill Gates, those people are in the middle, and 13 pharmaceutical companies heads together with US, UK, and several endemic countries representatives. We are making a very short speech, and that was a really very distinguished and dedicated moment that all of us are together doing something better for the people who are suffered in the, truly in the poverty and no medical infrastructure atmosphere. It was a really exciting. We are doing something good for the community, and we all contribute to the, societal goodness. That was a really exciting moment. I'm in a business, activities for many years, but I've never experienced such excitements before. It was a really exciting moment for all of our CEOs. And since then, it was tremendous experiences. We never had such things in a regular business, community at all. We met many new people. Of course, it was my privilege to get acquainted with Bill Gates, for example, and a lot of NGO and NPO people down in the field. We know what the Mass Drug Administration would look like. So just producing quality pharmaceutical products is not good enough. Actually, how we're going to make access to the real patients down in the field is a really another big issue, and that's far beyond our imagination. So it was a tremendous experiences, and we've been learning a lot from that. So yeah, that's the beginning of these experiences.
And just remind us, for those less familiar, so your ISA's drug was DEC, right, was around lymphatic filariasis. What was the history of that drug, and when had you started to explore its use?
That was a so-called DHL carbamazine for LF lymphatic filariasis. And Margaret Chan happened to said to me, Haruo, I have an issue. The DEC tablets are quite shortage, and nobody likes to produce it. They need high quality DEC tablets to combat LF. So firstly, we think about maybe cash donation for WHO, but I look back the issue. Oh, gee, we are a pharmaceutical manufacturer. Why don't we produce ourselves? So we use our Vizag, India facility. It's a very modern facility, and start producing DEC tablets from the very scratch. That time we didn't know how to produce it, where is the raw materials, but we're starting up and got the WHO specification quality clearance. And now we're providing over 2 billion tablets in those 9-10 years. And very fortunate we provide 26 endemic countries, and through WHO eradication programs, 70 countries declare the elimination of LF from their country.
Thank you. And we'll come back to talking about progress since, but just Sylvia Gold, moving to you just on the history first for a minute. Just tell us a little bit about how your foundation became involved. It was around Chagas, I believe.
Yes, thank you, Andrew. We are a family foundation. We were born in Argentina 29 years ago. We work focused on neglected diseases, but very especially in Chagas disease because it's our endemic disease. You know, Argentina is the country that has more patients affected by Chagas disease. So it's a moral engagement for us. So we work in the field, we have sites in the field, and we research to provide evidence to better public health policies. So we were quite local 10 years ago. And I remember walking in the street, I received a call in my mobile phone from Julie Jacobs. And she said me, we are launching a partnership and this will be great. And she explained me walking in the street. And she said, do you want to be there? Yes, of course. The only question was, can we contribute with our usual strategy? It's interesting for the partnership that we do what we know to do. And she said, yes, that's welcome. So what we commit to introduce Chagas disease in the list of the neglected diseases on the London Declaration. You know, the London Declaration has only 10 of the now 20 neglected tropical diseases. And Chagas it's one of these, and Chagas was not so, we said that was the neglected of the neglected, very unknown, and we commit to contribute in our way of working to go ahead in the control. So what we used to do is to understand barriers, to work to learn how to go to change these barriers, and that was what we commit in the first. I wasn't there in London, unfortunately. I couldn't see you, Dr. Naito. I had a problem. My son was there. Some people of the foundation were there, but we started working with the London Declaration from the first day. Yes.
And Maha, I think UAE formally wasn't in the front on the initial London Declaration, but I think it had already been involved for a number of years, hadn't it, in tackling neglected diseases. Tell us about the country's commitment and how that came about.
Thank you, Andrew. So the United Arab Emirates has had decades of working towards helping end neglected tropical diseases globally, and it really all started in 1990 when the founding father of the United Arab Emirates, the late Sheikh Zayed bin Sultan, who through a meeting with Jimmy Carter got to know about the Carter Center and the great work they were doing with trying to eliminate guinea worm. And His Highness the late Sheikh Zayed immediately donated $5.77 million of his personal money to contribute to the Carter Center's efforts back in 1990. And that really was the start of a continuing commitment by the ruling family of Abu Dhabi up until today. So just from the work with the Carter Center, guinea worm incidence has fallen by 99.99%. And there were only 27 cases in the year 2020. And His Highness Sheikh Mohammed bin Zayed Al Nahyan has personally contributed over $400 million to disease elimination over the last decade. So this is certainly core to the country's global health mission, and there is a specific focus on eliminating eliminatable disease.
And then, of course, since UAE has become more involved in that core group around the London Declaration, yes, moving us forwards to the years since.
Yes, and in 2017 there was the launch of the Reaching the Last Mile Fund. That was launched by His Highness Sheikh Mohammed bin Zayed with partners to look at really a proof of concept of concentrating on two entities specifically, river blindness and lymphatic filariasis. So that was a remarkable campaign that is been extremely effective. It was a 10-year program with $100 million, and so far, just in 2021, 18 million cases of river blindness and lymphatic filariasis have been treated over 200,000 frontline workers have been trained. There have been over 450 emergency surgeries. And I'm sure we'll talk about it soon, but of course it contributed to the wonderful announcement by Niger in December 2021 that they are, about to become certified by the WHO as having eliminated river blindness, the first country in Africa, and something that everybody thought was impossible. So these are all certainly dedicated efforts to ending neglected tropical diseases globally.
Yes, and Haruo, you mentioned earlier briefly some of the progress since. Bring us up to date about the last 10 years and what you've seen with the programs that you've been involved with. How much progress has been made since?
Yeah, let me talk about global pharmaceutical industry, how we are tackling on these NTD issues, because you may think we are just working for the profits, and it's completely wrong. For global pharma industry now, access to medicine is a major goal. All CEOs are thinking about day and night how we can accomplish that. And neglected tropical diseases or malaria, TB is including that target diseases. So we think NTD's importance is the same as oncology or the Alzheimer's disease. We're very much focused on various strategies, particularly pricing strategies. For example, our DEC tablets are price zero. I would not say it's a charity or something like that, because we think it's a true business. However, price is zero. But our concept, our goal, particularly, identify this is truly our business. Why don't you provide the drug with the price zero? Because it's going to create a productive population, increase middle income class. At the end of the day, creating the wealth from Africa or Latin American nations. Look at the globe now. In the future, coming wealth would be coming from those areas, and fighting to neglected tropical disease is good for global economy at the end of the day. And we are having the significance of contributing to that. Many companies are creating many different pricing policies, tiered pricing policy according to income, or they provide the risk-sharing pricing policy, or many new policy pricing policy is creating so that we can accomplish a good access to the medicine. So that is some of the developments this London Declaration brought into the global industry. Our way of thinking to the drug access is completely changed by joining this London Declaration.
And that's interesting. And the approach to pricing and access began perhaps then, or there was innovation for NTDs, but you say it's sort of now reflected more generally in many of your other medicines since.
Yeah, I think so, because if you look at the pipelines of NTDs, including Chagas diseases, we are also working for Chagas disease by collaboration with DNDi and using, your country's Silvia, and it's going well. And many cutting-edge technologies, such as, ASO, new modality, genetic research, those things are going on. So neglected tropical disease is not, something in an old-fashioned way, but we are applying a very modern technology, RNA, like, COVID-19 vaccine development. That kind of technologies are also applying to inventing new remedies, new chemical entities or vaccines for neglected tropical disease. So completely different picture now, and this is triggered by London Declaration, I believe.
Yes, that's great to hear that innovation to a wider world that's come out of the focus on some of the world's poorest and most neglected. And Sylvia, we heard there just on Chagas. What's your perspective on how things have changed, what's been achieved in the last decade since the London Declaration?
A lot, I think. We have big changes, probably not so impressive in numbers, but yes, in barriers eliminated that put us in the moment where I think we will see the impact. I think we are in a very special momentum. When we started, all the concept was vector control, but there were millions of affected patients without treatment. So we said, not only us, all the community of Chagas, what happens with the patients? But the main treatment was not available. If there was a shortage of the treatment, the production was interrupted and the transfer was not warranted. So the first thing we did, we are as a family also founders of a pharmaceutical group that's Insud Pharma. So we said we don't work usually, that's not the kind of products we produce, but we are concerned about access of patients, like Arwo said. So that's the main purpose of people working in pharmaceutical world. So we said we have to do it, and that was October 2011, and we started the production from scratch, also from the API to the tablet in really an incredible speedy time. In February, a month after the London Declaration, the first line of treatment that was Besnidazole, that's the API, was approved first in Argentina, but from Argentina, it was supplied to all the countries of the world since then. For the last 10 years, in any country of the world, you can have a treatment of Besnidazole sent from Argentina. Years after, we approved it also in FDA, what make it better. Anyway, it was approved by WHO and by PAHO. And having the treatment changes the world, because you can start creating awareness, you can start diagnosing, you can do that when you can offer a treatment. So that was the first barrier. The second barrier was there were no rules for the treatment, and after many years, PAHO published the guidelines for treatment and thinking in the chronic patient. Chagas is a difficult disease because it's a very silent disease. You can have the parasite during years, 10 years or more, without any symptom, and then develop a very severe disease. So you have to diagnose somebody that doesn't know that has the illness. So you have to create awareness. And that's hard because the patients are used to the idea that there is no treatment. So they don't want to know that they have the disease, because they heard many times that if you have the disease, there is nothing to do. So to diagnosis, to change the mind. The first times that we said Chagas can be cured, we received criticisms from the experts because something was not completely demonstrated, and it's not like this. It's cured. As diabetes is cured or HIV is cured, what means to being cured? To have a good life, to live without symptoms. That means to be cured for a patient. So we developed the treatment. The rules are now approved, and that changes completely. So today, and I know Dr. Greenspan will be after us in the panel, the good news for Chagas disease is that very recently an Ibero-American program was approved. That's a program for stop the transmission of Chagas disease from mother to child. The parasite can be transmitted from the mother to the child during the pregnancy. And the first step, that doesn't mean not to treat all the other patients, but our main campaign is no babies with Chagas disease. And that is now a program for Iberoamerica. And that's a regional program that is in the agenda of the head of state, and that's a program we started with Dr. Greenspan. I know she will be after us, and I want to mention that her commitment made this possible. So we are confident that we will now start changing number of patients treated. It changed, but not as it must. So I think we are in a very important momentum.
Thanks. So it's good to hear this continued expansion and evolution of programs. But let's in our final few minutes just talk about some of the challenges ahead. Not least aid cuts in some of the richer countries. Continuing criticism perhaps that some of the countries on the front line haven't themselves always stepped up in terms of resourcing, and then of course regulatory issues as well as concerns around continued momentum. Maha, any thoughts there? What do you see as the 2 or 3 biggest obstacles that need to be tackled to really go to scale and eliminate NTDs?
Thank you. So I think what we've learned from the Reaching the Last Mile Fund, and especially with the experience with Niger going through a wonderful achievement, we've learned the importance of innovations when it comes to mapping exercises. You really need to know where the burden of disease is. You need to improve on your diagnostic. You need to have advanced laboratory facilities so that your diagnoses are comprehensive and accurate. And you need to expand on your partnerships. You need multilateral partnerships. So that includes cross-border, pharmaceutical. You need to engage and activate technology and data. And data has really become front and center of many elimination programs for NTDs and other diseases. When you have accurate and quick access to data, almost real-time data, you can better monitor the effectiveness of your interventions. So you can concentrate on what works and discontinue or update, revise what doesn't work. You can move it to the affected areas more quickly. So I think data has become super important in this day and age. I think in terms of keeping the momentum, we're delighted that through the diplomatic efforts of the United Arab Emirates, we have the launch of the recognition of World Neglected Tropical Disease Day on the 30th of January every year. And we're hoping that becomes a medium to catalyze, increase financial commitments, and increasing number of partners who join the fight against NTDs, and obviously keeping political will and awareness going on an annual basis, and hopefully this will continue towards optimum and the quickest ending of these awful diseases.
And Haruo, what's your sense? What's missing? What do we now need to see from some of the different organizations, countries, players in this field to really move towards elimination?
First of all, Andrew, I may point out regulatory pathway for approval new drug for NTDs or malaria. We know COVID-19 vaccine or treatment, they are just quickly approved. Why not NTDs? I think it's the same situation. Actually, people suffered a huge number, yet, sometimes regulatory process takes time. We are requested that huge data, phase 3 studies, large population. Why not make it more flexible to have a quick pathway? And very limited. EU have some system. FDA has voucher, but it's still very limited. Why not measure? Agencies, regulatory agencies allow us to submit the data to them and very quick review, accelerated review. Those are privilege should be given to NTD development. This is one. Second one is still how we facilitate PPP, public-private partnership. This is a key partnership to solve the issue, and behind that we need a funding. Funding is still very limited. For example, here in Japan, we have a GHIT, which is a joint effort of Japanese government, Gates Foundation, Wellcome Foundation, and Japanese pharmaceutical company together, having funding for over $200 million in the past 9 years for over 100 more NTD, new chemical entities programs. And this is a PPP. Many academia circle, Broad Institute, Liverpool, Kentucky, those people are joined together with us to apply this GHIT funding. It's a truly PPP activities. So how are we going to enhance PPP arrangements with good funding mechanism? This is a second issue I think we need to confront. Maybe one more thing is, we need to deliver the medicine for those remote places where is no infrastructures. So recent remote medicine technologies, remote diagnosis, remote delivery of the drug, those are new DX technologies can apply to combat to NTDs. That may be something new we need to cultivate.
Yes, and Sylvia, finally coming to you, and of course, no doubt, COVID hasn't helped in terms of delivery mechanisms and other progress, but more generally, what would be the 2 or 3 key roadblocks that now need to be unblocked for progress, do you think?
COVID didn't help at all, but it left lessons. So I think what we learn, if we can use well what we learned. First, the agenda will change, I hope. Infectious diseases were out of the agenda. So I think that now prevention and conscious of the risk of infectious diseases and other risk of pandemics should be in the agenda, and I think it will be. So this is one change. I agree with Dr. Naito. Emergency use, approval for emergency use is a lesson learned, and I agree that also is emergency any disease where millions of people are suffering or dying. So I think that reflection on emergency use with warranty of safety and quality, but I think that a more flexible regulatory policy can help everybody, and with a lot of dialogue, I think that to include the agencies in the partnerships to discuss together for a more effective development of the products can help a lot. And I think the other lesson is that we need health system. There is no health if you don't have a strong health system. So I think that primary health should be prioritized, and I think that neglected diseases should be part of primary health. I think that any doctor, any health person involved should have neglected diseases in their mind. There are not rare diseases, there are common diseases, and I think that primary health is key. So that's, for me, the priorities.
Primary health, and indeed the wider infrastructure, clean access to clean water and sanitation, and those broader social development factors. Well, Sylvia, I think a perfect summing up. But thank you to you, to Maha, and to Haruo for your efforts and insights. And great to see, hopefully, perhaps even in another 10 years, we can come back together, because it sounds like there's continued commitment from you and your organizations amongst others, despite the challenges, very considerable, that we've been discussing. So thank you all three very much indeed. And I'm now going to hand over to Atul Gawande for a short declaration, who's the head of global health at USAID. Thanks very much.
Hi, I'm so glad to be here today. Thank you for including me. I'm especially pleased to be here in celebration of the progress that's been made in controlling and eliminating neglected tropical diseases. And also, I'm delighted to be here in recognizing the work that is still needed to be done to eliminate them completely. It is said that neglected tropical diseases exist quietly in the shadow of better known diseases. NTDs are lesser known, though, not because these diseases are rare, but because they afflict those who do not have the megaphones, the resources, or the power in the world. That's why it is so important that you all have gathered here today to lift not just these diseases, but these people out of the shadows. We cannot forget that we are all created equal, that all lives are of equal worth. And as evidence of what we mean by that, this work has now reached more than 40 countries where at least one NTD has been eliminated. I come in as the new leader of global health at USAID. And in this role, I am so proud to say that the US is honored to have helped 10 countries to reach that milestone of elimination. Since 2006, USAID has collaborated with more than 30 countries to deliver 2.8 billion treatments to stop 5 of the most burdensome NTDs. The contributions that this has leveraged from pharma companies has brought in a staggering $28 billion worth of medicines from 6 companies. And now I'm pleased to announce that USAID support has enabled 15 more countries to be on track to eliminate at least one NTD as a public health problem in the next 5 years. I want to take note that partnerships are what have made all of this possible. To end all NTDs, however, more partnerships, both public partnerships and private, are going to be needed. In order to ensure resilient, sustainable health for all, national leaders have to be able to ensure that neglected tropical disease services are incorporated into our systems, into national systems for health, for sanitation, for agriculture, and for education. All are key to eliminating NTDs, to ending them for good. We at USAID are completely committed to enabling us to lift neglected tropical diseases out of the shadows and finally bring them to an end. I thank you all again for being here, and thank you for including me.
Before we continue with the program, I just want to say, Ariel, you look very different.
Indeed, Tammy, I do. And that's because I'm actually making use of this fun avatar currently available on Snapchat and Instagram. Anyone can use it, and it's easy to find. All you have to do is to go on Snapchat, and it will be on your home screen carousel home filter, and simply search 100% committed, and it will come up. Alternatively, for Instagram, visit Uniting page at Uniting to Combat NTDs and click on the filter tab. Voila! Inspired by the 100% committed logo. It's designed to have fun, and there's no reason we can't all show a collective unity in a message we aim to share, and in a light-hearted manner too.
Well, it definitely gives you a whole new look, Ariel, but I must admit, I kind of feel left out. Don't you have one for me?
Oh, of course. We certainly do, Tammy. In fact, there are 2 avatars you can choose from, so hopefully no one should feel left out. There's something, everybody, we want to do to encourage people to have a little bit of fun with the post whilst putting a face onto the 100% committed campaign.
Well, I have no doubt the avatars will add something fun for every post, and at the same time providing people with the opportunity of having quite a bit to say. And speaking of quite a bit to say, our chat box have been certainly active since we have began our proceedings, and I encourage you to please keep the conversation going also on your social media pages. Please do keep your comments and questions coming, Your Excellencies and distinguished guests, because after today's events, all questions will be downloaded and addressed with the relevant parties so that a communication will go out with comments, questions, and their respective responses. We also value your input, and whilst we can't read out all comments or questions, please do keep them coming.
Yes, absolutely, Tammy. As you mentioned, or should I say, absolument, Tammy. Right? Nous poursuivons maintenant la deuxième moitié de notre formalité en accueillant une femme aspirante et exceptionnelle qui, le 13 septembre 2021, a été nommée 8e secrétaire générale de la Conférence des Nations Unies sur le commerce et le développement. Elle est la première femme dans l'histoire de l'organisation d'occuper cette poste pour partager son point de vue sur la campagne 100% engagée. Votre Excellence et invitée distinguée, notre propre président UTC, Madame Rebecca Greenspan.
Thank you, Ariel, for your presentation. Your Excellencies, honorable ministers, distinguished participants, ladies and gentlemen, all protocols observed. I am honored to be joining the global movement to fight neglected tropical diseases as the new chair of the board of United to combat neglected tropical diseases. What a time to be joining the partnership as we celebrate the achievement of the London Declaration on NTDs, launch the 100% committed movement, and kick off commitments and endorsements of the London Declaration. We have heard from people affected by neglected tropical diseases about just how much pain and suffering these diseases cause, and why these diseases need to be ended for a more equitable and just society to prosper. But we have also heard about the incredible progress we have made in the fight against NTDs over the last decade. Today, building on this previous success and recognizing the changing global landscape, we are using World NTD Day 2022 as a catalyst to translate awareness into action, into more funding, and crucially, into more political leadership and ownership of NTD programs around the world. By working together, adopting people-centered approaches, and collaborating across sectors in an integrated manner, we can and we will achieve the targets of the World Health Organization NTD roadmap. These targets include the eradication of 2 diseases and the elimination of 1 NTD in at least 100 countries by 2030. It is this target of eliminating at least one entity in 100 countries that has inspired the 100% committed movement. The 100% committed movement exists to connect and amplify our voices, especially those of affected people. Together, we call on our governments, parliamentarians, mayors, and local governmental leaders, as well as continental and regional bodies, pharmaceutical companies, donors, multilateral organizations, academic and research institutions, non-governmental organizations, and young leaders around the world to show they are 100% committed to ending entities. So to be 100% committed to ending neglected tropical diseases means, first, using your voice to champion the 1.7 billion people affected by an entity, sustaining and increasing commitments in the fight against neglected tropical diseases, taking ownership of national programs, and endorsing the Kigali Declaration on Entities. Ending entities is possible within our lifetime, and now is the moment for us all to make the commitments that will allow us to realize that future. I am 100% committed to ending entities. Are you? Now, distinguished guests, it is my great honor to introduce our next speaker to this session. As alluded to earlier, the UK government has been a strong supporter of entity programs over the last 10 years. As we prepare to pass the baton from the London Declaration on Entities to the Kigali Declaration, we would like to recognize the contribution of the UK. So it is my pleasure to introduce and welcome the Minister for Asia, whose responsibility includes global health at the Foreign, Commonwealth and Development Office in the UK, the Honourable Amanda Milling MP. Welcome to you, Honourable MP. The floor is yours.
Hello everyone. Today we mark 10 years since we took a monumental step forward in the fight against neglected tropical diseases. We've made incredible progress since the London Declaration, progress that has changed billions of lives for the better. We still have a long way to go, but as we look forward to the Kigali Declaration, there's a great deal of hope for the future. This is a moment to focus on the next decade. These diseases continue to have a terrible impact on 1.7 billion people around the world. Children missing school, parents unable to work, families unable to throw off the shackles of poverty. Nations fettered by financial burden. The UK government played a vital role in the London Declaration, and we have since helped to deliver billions of treatments. The Declaration spurred action not just from governments, but companies, campaigners, scientists and philanthropists. And we have all witnessed the benefits of that collaboration. For 5 years in a row, more than 1 billion people have benefited from treatments for neglected tropical diseases each year. 43 countries have eliminated at least one of them. We know that strong health systems are vital for preventing and treating these diseases. That's why the UK continues to work with affected countries to ensure they have the strong foundations in place to help all of those in need. This is supported by our investments in research and development, which are helping to drive progress through new drugs and treatments. COVID-19 has had a negative impact on this work, and I hugely appreciate the efforts of the World Health Organization and partners to keep things on track. I'm also grateful to those on the front line of the fight to combat neglected tropical diseases, the community health workers and the volunteers who risk their own health to protect the vulnerable. We see you, we applaud you, you are vital. The UK will continue to demonstrate leadership in global health, with our sights fixed, as ever, on constructive, evidence-based work that directly benefits those most in need. So today, we have a clear mission, a clear call to action. Today, we look ahead to the Commonwealth Heads of Government meeting in Rwanda and the Summit on Malaria and Neglected Tropical Diseases. The UK warmly welcomes the new Kigali Declaration, a declaration that will take forward the progress we've made with renewed vigour and energy, a declaration that will harness the power of collaboration, a declaration that will encourage the countries most affected by these diseases to be right at the centre of the response. Yes, we're facing a difficult road ahead, but with our eyes fixed firmly on our goal to end suffering caused by these diseases forever, and with renewed drive displayed here today, I know that we will get there. Thank you.
A huge thank you to Amanda. It's now time that we'd like to acknowledge the dose poll that Ariel is holding, symbolic of what is now the official handover from the London Declaration to the Kigali Declaration.
Exactement, en acceptant ces bâtons symboliques au nom d'un pays souvent avec tendresse appelé le pays de 1000 collines, ou en anglais, the land of 1000 hills. Veuillez souhaiter la bienvenue au Premier ministre du Rwanda, très honorable Dr. Ngirente Edouard.
Excellencies, distinguished delegates, on behalf of His Excellency Paul Kagame, the President of the Republic of Rwanda, I am pleased to join you today for the virtual launch of the Kigali Declaration on Neglected Tropical Diseases, NTDs. I would like to thank the Uniting to Combat Neglected Tropical Diseases Coalition for hosting this high-level event. I also want to thank all of you for setting aside time out of your busy schedules to participate in this important event. Excellencies, distinguished guests, neglected tropical diseases have negative effects on those affected and can kill them. Intestinal worms and other NTDs contribute to the stunting of our populations. Globally, about 1.7 billion people are estimated to be affected by NTDs. Africa is the most affected part of the globe, with almost 40% of the global NTD burden. In Rwanda, we are similarly affected by common NTDs. Today, COVID-19 has shown the critical importance of investing in strong primary healthcare systems. These can both respond to endemic diseases, including NTDs, and make the world more resilient to pandemics. Excellencies, distinguished guests, we need binding commitment to fight NTDs to ensure the next generation is free from their negative effects. To achieve this, there is a need to effectively implement the roadmap that will guide our actions for the next decade. In the context of the One Health policy, Rwanda commits to enhancing collaboration with different actors to respond to the NTD burden. These include stakeholders and partners working in water, sanitation and hygiene, as well as the agriculture and animal sectors. Additionally, Rwanda commits to eliminate NTDs as a public health problem by 2030. Rwanda has already eliminated some NTDs, including the 5 skin NTDs. we are currently collecting evidence for WHO validation of their elimination. The Kigali Declaration on Neglected Tropical Diseases supplements the London Declaration by incorporating country ownership of NTD programs. This means increasing domestic financing and also encouraging sustained and renewed commitments to reach the Sustainable Development Goals targets related to NTDs. This framework will further help in achieving the ambitious targets set out in the WHO Neglected Tropical Diseases Roadmap 2021-2030, which was launched in January 2021. Excellencies, distinguished guests, more commitment and endorsement for the Kigali Declaration on NTDs are needed to achieve a better future for our people and reach the 2030 targets. Those commitments and endorsements will be unveiled during the launch of the Kigali Declaration on NTDs during the Malaria NTD Summit in Kigali on the sidelines of CHOGM later this year. Rwanda looks forward to welcoming you to Kigali for this important summit. In closing, I take this opportunity to express my gratitude for your commitment and look forward to seeing a high level of ambition in our joint effort to eliminate NTDs by 2030. I hereby announce the official kickoff of the Kigali Declaration on Neglected Tropical Diseases. Thank you for your kind attention. Excellencies, we come together 100% committed to end neglected tropical diseases. By working together, adopting people-centered approaches, and working across sectors, we will meet the Sustainable Development Goals targets on neglected tropical diseases and the WHO 2030 Neglected Tropical Diseases Roadmap. Please join us and 100% commit to ending neglected tropical diseases. Thank you so much. Excellencies, distinguished delegates, I am delighted to be joining the 100% committed movement to end neglected tropical diseases. I call upon head of states, original endorsers of the London Declaration, and new partners to join this movement, endorse the Kigali Declaration, and 100% commit to ending neglected tropical diseases.
What a powerful moment that was. Thank you, Right Honorable Dr. Ngirente Edouard. We are excited to be joined by heads of state from a number of countries representing our launch champions of the 100% committed campaign. They are initial endorsers of the Kigali Declaration on NTDs from the most esteemed and populous countries in West Africa, home to the second largest film industry on the globe, whilst also being fashion, technological, and the creative hub in Africa. It is our pleasure to welcome, representing His Excellency Muhammadu Buhari, the President of Nigeria, Your Excellencies, and distinguished guest, the Federal Minister of Health, the Honorable Dr. E. Osage.
Nigeria currently has the second highest NTD burden in the world, understandable because of our population size. and it is endemic to 14 of the 20 diseases classified by the World Health Organization as NTD. Millions of Nigerians stand the risk of contracting NTDs, while at least 45 million children and young people below the age of 14 are at risk of parasitic worm infestation. This infestation can place limitations on a child's ability to learn or can significantly reduce their potential later in their lives, thereby perpetuating the cycle of poverty. Nigeria has demonstrated that NTDs can be prevented, treated, and eliminated. In 2013, we eradicated guinea worm disease, which for decades had affected hundreds of thousands of people, especially in rural parts of the country. We also eliminated the transmission of onchocerciasis in 2 of our states, Plateau and Nasarawa, and conducted interventions, resulting in 79% reduction in the prevalence of trachoma in Nigeria. Nigeria has also made significant strides towards eliminating other NTDs, specifically by institutionalizing a basic healthcare provision fund, which caters to the health needs of the poor and vulnerable in the community. Basic Healthcare Provision Fund supports our goal to improve government budgetary allocation to NTDs as we continue collaborating also with our development partners in the NTD space, like the World Health Organization, to achieve the 21-2030 NTD roadmap. Eliminating NTDs in Nigeria will continue significantly to the attainment of the Sustainable Development Goal 3.3, aimed at ending AIDS, TB, malaria, and NTD, and combating hepatitis, waterborne, and other communicable diseases. It is our belief that the Kigali Declaration, a high-level political declaration following the London Declaration, will mobilize political will and secure the commitments to facilitate achievement of SDG 3. I wish to thank all groups and persons who have worked so hard with us to achieve the results of today and recognize their efforts towards resource mobilization for NTD elimination, not only in Nigeria, but in the world. I'm pleased to now declare that I have accepted the call to be the global launch champion of this movement to end neglected tropical diseases, and hereby take up leadership by kickstarting the endorsement of the Kigali Declaration. Nigeria is 100% committed to eliminating NTDs, and I hereby encourage other countries to do the same. I wish you all successful 2022 World NTD Day commemoration as we work together with the theme of the campaign, Achieving Health Equity to End the Neglect of All Poverty-Related Diseases in the World. I thank you all for your kind attention. Signed by President Muhammadu Buhari, President of the Federal Republic of Nigeria.
Thank you very much, Honorable Minister. It gives me a great pleasure now to welcome our next speaker from Africa's highest mountain, Kilimanjaro, the wild-rich national park such as Serengeti. Your Excellency, distinguished guest, the President of Tanzania, Samia Suluhu Hassan.
Good afternoon to you all. Ladies and gentlemen, I'm delighted to join you all this afternoon to launch the 100% committed campaign and kick off commitments for the Kigali Declaration on Neglected Tropical Diseases, NTDs. Tanzania is among the highly affected countries with NTDs in the world, with over 29 million people requiring treatment for at least one NTD. This is nearly half of our population and includes 19 million children at risk of intestinal worms. These NTDs, particularly intestinal worms in children, limit educational opportunities for school-age children by interfering with cognitive development and causing undesirable effects on school attendance and child development. I understand in endemic community, NTDs have trapped individuals in a cycle of poverty, leading to social stigma at the family and community levels. Combating NTDs needs substantially large investment to ensure sustainable access to services and adequate monitoring. Limited resources and competing priorities have been hindering these efforts to minimizing the pace towards realization of NTDs free nation. Despite challenges, as a nation, we have made and continue to make great progress in the fight against the NTDs. For example, we have reduced the number of districts that require preventive treatments for lymphatic filariasis from 119 districts in 2004 to 8 districts by 2021. We have reduced the number of districts that require preventive treatments for trachoma from 71 districts in 2012 to 9 districts by 2021. We have also reduced the number of people requiring surgical interventions for trachoma from 167,000 in 2012 to 27,000 by December 2021. These are remarkable achievements and have put my country on a track towards elimination of both trachoma and lymphatic filariasis. It is for this reason when I received the invitation from Uniting to Combat NTDs to become a champion for neglected tropical diseases and the Kigali Declaration, I responded without hesitation. I strongly believe that through this meeting, we are going to revamp our desire, support, and commitment in tracking NTDs. This meeting will lay a platform to transform the lives of individuals, including millions of women and girls in Tanzania and around the world who are at risk of being infected with NTDs. I believe commitment that we are going to pledge in this meeting today will help build equitable access to quality essential health care, which is paramount in limiting the transmission of these preventable diseases. It is only through country leadership and ownership that we can truly end these diseases. I'm very pleased to learn that the first goal for Kigali Declaration emphasizes on the need to work to ensure people affected by NTDs, particularly women and girls, persons with disabilities, and minority and other underrepresented groups at the center of NTD programs and decision-making processes. I therefore commit my full support to ensure that these and other goals within the declaration are realized. Ladies and gentlemen, finally, as I'm very pleased to be amongst the first world leaders to endorse the Kigali Declaration on NTDs, I'd like to reiterate my readiness to champion the fight against NTDs, and I commit to offer my full support and call on world leaders to endorse and commit to the Kigali Declaration. By supporting our national NTD programs and integrating programs into our health systems, we in Tanzania are demonstrating that we are 100% committed, and I thank you.
a very big thank you to Your Excellency Samia Suluhu Hassan. Now, I just wanted to take a moment and acknowledge that it is actually her birthday today. We just got word that it is her birthday. So wherever you're joining us around the world, let's just take a moment to please just sing a happy birthday to Her Excellency President Samia Suluhu Hassan. Happy birthday to you. Happy birthday to you. Happy birthday, dear Your Excellency. Happy birthday to you. Thank you so much, everybody, for joining us. Our final launch champion represents a country of immense cultural and biological diversity. We're honored to announce the Prime Minister Marape of Papua New Guinea, who has agreed to be a champion for the 100% committed campaign and for the Kigali Declaration.
Unfortunately, the Prime Minister sent his apology that he cannot join us, and it is hard as he has planned. Rest assured, however, you will be hearing from him as part of his campaign. Thank you, Papua New Guinea. Here's some interesting comment, feedback that we have received.
So we've got one from Gabrielle Leng, who says, great to hear One Health approach being embraced. Lots of potential to collaborate with those from animal and environmental health to reach roadmap targets. The NNN have been working with WHO, and on Sunday we will launch an official companion document to the roadmap of One Health for NTDs. I'm going to read one more to you as well. Thank you, Nigeria, for being a leader in the elimination of NTDs. 100% committed to supporting Nigeria's 2030 NTD roadmap. We would really like to thank and engage with you further, and we're very excited to know your thoughts and ideas on new and innovative ways to continue on this life-changing initiative we call 100% committed. Please continue to engage with us and leave your valuable comments and questions on all our social media platforms, as well as on our official website, www.100percentcommitted.org.
We look forward to hearing from you and appreciate your contribution. You can make a difference. Together, we can really make that difference.
I couldn't agree with you more, Ariel. Your Excellencies and distinguished guests, we would like to take this opportunity to extend a big thank you to all our speakers and launch champions for their invaluable time today. We certainly accept the challenge and look forward to stepping up as we head into a new era with the Kigali Declaration. We conclude our event today with a very special performance of a song specifically created and composed for Uniting to Combat's 100% committed campaign. Without realizing it, you've actually been hearing extracts of the tune throughout the course of today, but now it gives us great pleasure to present to you its world premiere.
Nous avons eu l'honneur de passer cet après-midi avec vous en aidant à mettre la lumière sur le travail très important entrepris par Uniting to Combat, en français, Unis pour combattre, ainsi qu'on reconnaissait la tâche vitale et prochain chapitre de leur incroyable voyage qui leur attend de Londres à Kigali. Engagé de 100% meilleur Ariel, et on va voir, we are not waiting anymore behind. Together, we are strong. Join the fight. Your Excellency, distinguished guest, on behalf of Ariel Dinenga and, of course,
Tammy Karimeng, thank you for joining us, and wherever you may be, our hope is that you continue to remain safe, well, healthy, and 100% committed. From the entire team, a very good afternoon. This is indeed 100% committed.
Somewhere, Mama Damon, her child, and Papa, they slowly lose them sight.
do we make things right? Let your actions show. Well, talk is not enough, just be the words you say. There are people dying while you hesitate.
If only one is hurting, we are all in pain.
If we stand together, we'll never fall again.
We can give someone a chance to live a better life, to see through better eyes. Join the fight,
So light a fire, take the spark around the world. Let the human spirit burn, and our voices will be heard. And we're not leaving anyone behind. Together we are strong. In a better world is where we belong. Join in the fight, be the voice of hope. How do we make things right? Let your actions show.
Like kinds of light in every dark corner, like floodlights crashing through the gate. Our voices ring loud, our spirits burn bright. With our action now, we determine how long this fight would last.
So let's walk the talk, till our feet leave landmarks in the sand, till our pleasures become rhymes, kids will sing with a smile in the memorial of victory. We are 100% committed, we are honoring our pledges, so be 100% committed to ending the negative tropical diseases. So are you with us? Because
we're not leaving anyone behind. Together we are strong. In a better world is where we belong. Join in the fight, be the voice of hope. How do we make things right? And we're not leaving anyone behind. Together we are strong. In a better world is where we belong. Join in the fight, be the voice of hope. How do we make things right? Let your actions show.
Être 100% engagé à l'élimination des maladies tropicales négligées.
mwetendeteka okuba nga mutwala obulwaire bw'omusobola
অবহেলিত গ্রীষ্মমণ্ডলীয় রোগসমূহের অবসান ঘটাতে আমাদের শতভাগ প্রতিশ্রুতিবদ্ধ হতে হবে।
आए मिलकर नजरअंदाज शुदा ट्रॉपिकल डिजीजेस को खत्म करने के लिए 100% पर अज़म रहें।
Komitmen 100% untuk mengakhiri penyakit tropis yang terabaikan.
Make we run maximum effort for the Bege against Yamayama disease.
Be 100% committed to ending neglected tropical diseases.